platform. So my name is Rodrigo Scotini. I'm the executive director of IDA, the Infectious Disease Alliance, based in Copenhagen, Denmark. I'm from Brazil. I have more than 10 years of experience in public health from various organizations, mostly from international organizations like the European Commission, European Parliament, WHO, OECD, also from foundation, the World Diabetes Foundation, and from ICARS in antimicrobial resistance. And before my current role, I was in Novo Nordisk, a very spoken company nowadays, in Denmark at least. I have a background in public policy, so my focus a lot on policy. I'm not a scientist, at least like a hard science or biological scientist, more like a social science and political science. My interest is a lot in how does the world will look like in the future, but mostly how can we shape it. I'm a very concrete person, so I want to have the global overarching strategic overview, but I'm also someone who looks at how to implement those. And for me, policy is a very concrete way of promoting those changes on global and national level. So I'm someone who is passionate by partnerships, relationships, like connections to political drivers and or implementers. IDA hosts also two coalitions. So first of all, IDA works on infectious diseases. So as you can see from the virus here on the backgrounds, we are a civil society alliance having more than 70 organizations from around the world as members. We work in the main areas of infectious diseases such as vaccines, antimicrobial resistance, neglected tropical diseases, respiratory diseases, vector-borne diseases, and so on. We also have a focus on like more cross-cutting focus on One Health, gender equality, climate change, research, and so on. So that we can cover a broad spectrum of infectious diseases representing our community. And some of the focus we have taken in our organization, the two main focus is primary healthcare and health finance. For two reasons. Health finance, I mean, talking about the year of 25 has been a crossroads in terms of not only finance, but like if we're going to the future or to the past. And looking at some perspectives, the past might be even more promising than the future in terms of number. But that's not what we want. We want to continue progress in healthcare globally, and finance has been unfortunately not an element that has been contributing to that. So we have been working with some partners, including also Lars in that group, to help shape global health in a better way through finance as well. And primary healthcare is absolutely a key driver for that change. I mean, it's the implementation part, obviously. And we see the future where actions are not siloed anymore, but are more working on a horizontal way. So that primary health sector should play a much more important role. That finance should go to private sector, to primary sector. So that's a little bit about the vision I and IDA have for the future, and happy to be here and get to know the other members and have fruitful discussions.